Dr. Meltzer, it looks like you're really focusing in on the whole idea of self-empowerment, and that's where the first line of defense starts. Does that mean that you're nullifying the value of traditional medicine?
You know, I have great respect for traditional medicine. I mean, I'm a medical doctor. You know, I believe in traditional medicine in many parts of it. You know, first of all, traditional medicine as far as crisis intervention, as far as emergency medicine is concerned, as far as pain management and serious infections, in other words, acute illnesses, you know, traditional medicine is fantastic. If you ever have a loved one or someone that's in your family that's ill and they're in pain or they're really sick, let's face it, we want to get to the hospital. So, you know, traditional medicine has some huge assets, tremendous inroads technologically and pharmacologically in helping people who have acute illnesses. But see, the difficulty is that only represents maybe 10 or 15% of medicine. See, the future of medicine is integrative medicine, where you take traditional medicine and preventive medicine and you work together. For example, preventive medicine is your first line of defense. You empower individuals to be well and stay well. You teach them the fundamentals of self-awareness, self-responsibility, self-accountability, balanced living, good eating, healthy exercise, healthy, happy relationships. You know, you try to create a balanced lifestyle. That's your first line of defense. Now, if for whatever reason you incur an illness, you have a problem, that's what the hospitals and doctors are for, you see. They're the backup system, but they're not the first line of defense. So I have tremendous respect for traditional medicine. As a matter of fact, as a primary care doctor, a lot of what I know and a lot of what I do comes from my knowledge of traditional medicine. But I'm very much aware of its limitations, and its limitations are in treating chronic illness. In other words, it doesn't cure chronic illness, it doesn't prevent chronic illness, it manages chronic illness. I don't want to manage chronic illness. I don't want to assume chronic illness is inevitable. There are certain amounts of chronic illness that can be prevented. I believe a great majority of it can be prevented. I mean, for example, just imagine if as Americans we weren't overweight and we quit smoking. Just two little things. Our health would improve tremendously. Forget exercise and just obesity and cigarette smoking. So, you know, there's a lot of things people can do to get healthy. But the first line of defense is preventive medicine. What that does is it empowers the patient. It empowers the primary care doctor to look out for wellness. In other words, I have so many of my colleagues, if you see them, you see an orthopedic doctor or you see an ophthalmologist and you're overweight or you're depressed, they're not going to deal with it. They're passive about it. Preventive medicine gets passionate about burnout. It gets passionate about teaching you how to be well. So I think it's working together is key. Traditional medicine is super important. You can't have a healthcare or disease care delivery system without traditional medicine. But where's the prevention? Where's preventive medicine? You know, as I said, if you hold up the graph, if you look at President Obama's policy here to solve the healthcare crisis, in this one little corner is preventive medicine. No, preventive medicine is huge. It ought to be at least 2/3 of what's going on, and then perhaps 1/3 towards traditional medicine. If we can keep people well and healthy and happy, we're going to prevent a lot of chronic illness. So I think it's crucial to integrate and work together traditional medicine and preventive medicine side by side, hand by hand, shoulder to shoulder, working together under what I call integrative medicine, giving people the best of both worlds. Teach them how to be well, educate them on what it takes to be well and stay well, and then those folks that get into difficulty, we have traditional care, and I think that's a wonderful system.
30 years ago in San Diego Magazine, you were quoted as saying that the main responsibility of the primary care physician is to zero in on preventative medicine, to educate his patient or her patient to preventative medicine. How are we doing 30 years later?
We're close. We're close. You know, I think what's going to happen is this. You know, I think the primary care physician, if he can expand his role to be an educator, a facilitator, a guide, to help folks get on a wellness program, to introduce concepts of self-awareness, nutrition, fitness, meditation, stress management. You know, in other words, I think that, for example, let's say someone comes into your office with high blood pressure or something like that. The primary care physician can guide people in behavior modification, in making different lifestyle choices. So I think it's a huge way. I think it's a great way to bring the integrative process together. The primary care doctors are basically out there working with their clientele to keep them well and educate them and facilitate their wellness process. Those folks that do come down with illnesses, that's where a traditional medical team is available. And of course, for acute illness, we have a fantastic traditional medical team in emergency medicine and crisis medicine and things of that nature.
You have covered a wide array of subject matter regarding these issues. Any final thoughts for us?
You know, the only final thoughts is this. We have a common goal. You know, I think the common goal in our society right now is to improve health care, cut down the cost of health care, and improve the quality of health care, and improve the quality of our lives. Now here's what the American public has to understand. The current approach to health care reform, President Obama's program right now, is misleading. It will not address the problem. It will not solve the healthcare crisis. Until we address the primary cause of the healthcare crisis, which is chronic illness, until we switch over to having a healthcare system as well as a disease care system, we're not going to solve the problem. And the future is preventive medicine, empowering people, empowering the individual, not empowering disease, empowering individuals to be well, empowering people to stay well, empowering families to work together to stay well, to educate people on the tools and the resources of being well. That's the future. That's the way to prevent disease. That's the way to solve the healthcare crisis in our country today.
Dr. Meltzer, thank you so much for being our guest. You've given us some very refreshing insights.
Thanks very much, Noel. It's been a pleasure to be here.
Thank you for being our guest.